Morning, everybody. Thank you for joining us for our press briefing today. Today, we are going to be talking about Heritage Health Adult, otherwise known as Medicaid expansion. But before we get into that, again, we want to remind people that, again, during the pandemic, we still want to practice all of our good social distancing rules, which means to keep that 6 feet between you and other people when you're out in public. Wear a mask if you're going to be closer than 6 feet to somebody, especially if you're going to be inside, and wash your hands often. These are the 3 basic rules that will help us make sure we continue to control the spread of the virus. So please keep those in mind. And of course, we also want to remind people that we appreciate all their sacrifices for all the restrictions we put in place and all the things they've had to do to slow the spread of the virus. It has been absolutely successful. We've been able to maintain our hospital system. Currently, right now, we've got 38% of our hospital beds are available, 42% of our intensive care unit beds available, and 78% of our ventilators are available. So we continue to have robust hospital capacity here in the state of Nebraska to ensure that if somebody does need that hospital bed, that ICU bed, or that ventilator, they can get it when they need it. And so continuing to talk on related health matters, we'll get back to Heritage Health Adult. So reminder, I'm sure everybody knows that the voters of Nebraska passed Initiative 427, which at the time was called Medicaid expansion, to be able to expand the population of people being served by Medicaid. And the team at DHHS has been working to get that implemented, and we are planning on an enrollment date of August 1st and a coverage date starting October 1st. So this population will be probably about 90,000 additional people joining. It's for those who are at 138% of the federal poverty level. So if you're an individual, it's about $17,600 in annual income a year. A household of 4 is about $36,150 or so. So you kind of get the general range of what we're talking about with regard to the people be covered. Ages people 19 to 64. And the folks who will be signing up for that coverage will get an insurance coverage package, or a coverage package that looks like what you probably get in a private insurance coverage. You'll have physical health, you'll have behavioral health, you have prescription drugs. We also, for folks who are 19 to 20, pregnant, or determined to be medically frail, will also be able to get the dental, vision, and over-the-counter drugs as part of their coverage. And we have a waiver in with the Center for Medicare and Medicaid Services, CMS, to be able to expand that prime coverage as well. But with the pandemic, CMS has told us that that application process is delayed as they respond to the pandemic. So at some point, the rest of the folks who are signing up for Heritage Health Adult may have access to that as well. So we will continue to work that with the Center for Medicare and Medicaid Services. So we're going to be rolling this out. We are working on the technology to be able to deliver that. So you'll be able to access this service and sign up for it at accessnebraska.ne.gov, and that's the website. And we really want people to go to the website to do this, because that is going to be the easiest, most efficient way to be able to make sure we're covering it. Having said that, we have also hired an additional 68 eligibility staff to be able to help folks make sure we get those applications processed and so forth. We do have a phone number that you can call into as well. That number is 855-632-7633. That is a toll-free number. But again, we really prefer people go to the website. Now, again, as you can imagine, starting August 1st, when we estimate 90,000 or more people start applying for this, you can imagine it's going to be a lot of people coming in all at once. So please be patient with us as we go through this process. Again, we would prefer people to go to that accessnebraska.ne.gov to be able to sign up. But again, please make sure that you're patient with us as we go through this application process. We do want to make this a great customer experience. That's why we have hired the additional eligibility staff. And then we also are putting in place a dashboard so we can make sure that the applications are processed correctly and timely. So that is going to be something we're going to be measuring as well. So, but again, please use the website, accessnebraska.ne.gov. It's going to be the best way to be able to sign up for that. With me today, I do have Danette Smith, who is the CEO of our Department of Health and Human Services. to come talk about this, as well as Jeremy Brunson, who is the director for Medicaid. He will be here to go into the details as well. Danette actually has some other things she's got to take care of this morning, so she's going to come up, and then she's going to have to leave. But Danette, you want to kind of introduce Jeremy and get us started on this? Great.
Well, good morning, Governor, and good morning to everyone. So pleased to be here this morning to talk about Heritage Health Adult Medicaid expansion. And this morning, I'm going to be joined by Jeremy Brunson, who is our Director of Medicaid Expansion. As the Governor said, we will be accepting applications August 1st, 2020, with coverage actually beginning October 1st, 2020. And we are very excited to be able to launch the Medicaid expansion piece. Again, we want to go back over and say to you, please apply www.accessnebraska.ne.gov. We will also be giving the media here in the room a list of phone numbers where you will be able to call. We are making sure that everyone in Nebraska has a wonderful customer service experience. Not only are we increasing the number of staff, but we're also going to be bringing on board a call center to address and answer any questions that you may have. As the Governor has stated to you, DHHS is estimating approximately 90,000 people will be newly eligible for Medicaid expansion, and we want to give everybody an opportunity to apply. Over the next course of the next couple of weeks, we're going to be focusing on 3 areas. One, we want to get the word out about Medicaid expansion. And so you will see a lot of media, both online media, but you're going to see postcards. We'll be meeting with our constituents as well as our associations and providers to make sure that everybody has the correct information. They know how to help our constituents get enrolled, and so that we can provide the best service. The second thing that we're going to be doing, and you just heard the Governor mention about the new 68 positions that have been hired again, we're going to embellish that, and we're going to look at bringing on a call center who can directly answer those questions for the public about anything that has to do with expansion. And then finally, our technology bill. We are very excited about the work that our MCOs are doing with us, the user acceptance testing that is going on right now to make sure that our MCOs are going to be able to assist us with being able to process those applications and provide good customer service. So without further ado, I announce or have Jeremy Brunson, our Interim Director of Medicaid Expansion, to come up, talk a little bit more with you about the details, who qualifies, what they can expect in those tiers, maybe talk a little bit about the 1115 waiver, because we have gotten some questions. So Jeremy, will you join?
Thank you, Danette. Good morning. Thank you for allowing me to be here this morning and provide an update to you all on the work that our teammates have been doing at DHHS to prepare for the launch of Medicaid expansion. So as mentioned, we are right on pace and will begin accepting applications on August 1st. As CEO Smith mentioned, we have completed many phases of our testing processes for eligibility determinations and continue to work through the other final phases of the technology end-to-end testing with our MCO partners, where we transmit files back and forth, and everything is going as planned. So with that said, we are in a position and did make the decision to go ahead and push forward with accepting applications August 1st, with all of our testing being successfully completed, along with the eligibility for new beneficiaries beginning on October 1st. Regarding the benefit levels, both Governor Ricketts and CEO Smith mentioned the 2-tiered benefit plan. So the basic benefit package is a very comprehensive, robust benefit package that includes, as mentioned, the physical health, behavioral health, and prescription drug packages. It includes things like ambulatory care, emergency situations, hospitalization, maternity and newborn care, mental health and substance use disorder services, prescription drugs, rehab and rehabilitative services and devices, laboratory services, preventative wellness and chronic disease management, other things such as long-term care, non-emergency medical transportation, and durable medical equipment. So a fairly robust package of services. In addition, those that are eligible for the prime because they're either medically frail, are 19 or 20 years old, or pregnant women, they will also receive those dental, vision, and over-the-counter medication eligibility coverage. We would note that in the case of emergency situations, those individuals that are in the basic package will have access to emergency dental and other eye care as needed in emergency situations. As Danette Smith mentioned, our CEO, we have onboarded 68 additional eligibility staff that are going to be helping us with eligibility determinations for the newly eligible populations that are applying. We've brought on additionally 55 call center agents through a call center that will help us take changes and new applications over the phone for those folks that do call the Access Nebraska hotline. And we feel very confident that we're in a great position to process applications and ensure that beneficiaries that do apply have a good experience and have those benefits available to them when the program begins on 10/1. So thank you very much. I appreciate the opportunity to provide an update. One last item that Danette had asked me to provide an update on was regarding the status of our demonstration waiver application, the 1115 waiver. As noted, and understandably so, CMS, our federal partners, had to take a detour on processing our application in the early spring and March in order to be responsive to every state and their needs with managing through COVID and the pandemic. So we did obviously announce back in March that we would be needing to move forward with expansion as planned and then implement provisions of the waiver at a later date. I'm very happy to say that we've had a lot of great conversations recently with our federal partners around the special terms and conditions of that waiver, and we're in the negotiating process to make sure that we are able to get that waiver approved and implemented as soon as reasonably possible. So, thank you.
Thank you, Jeremy. All right. Okay, a couple other things. One, as I'm sure you're aware, at least the folks in the room are, or the viewers out there may be aware, that the legislature was interrupted back in March with the pandemic, and today is the first day that they are resuming to finish the final 17 session days that they have. So we'd like to welcome the legislature back to the Capitol building and wish them well as they work on the people's business here. Also, for this week, our upcoming schedule is we will have a press briefing here tomorrow at 1 p.m. to continue talking about our back-to-school issues with regard to the pandemic here in the state of Nebraska. So please tune in for that. And then on Thursday at 10 a.m., there will be a Korean War veterans program as well. So with that, Taylor, what I would like to do is hit the questions that were submitted in advance. Can you help me out with that?
Yeah, Paul here would like to know, what's your plan for your children? Will they be returning to school this fall? Why or why not?
So Paul Hamill from the World Herald wants to know what's the plan for my children. I've got 3 college-age children. My plan is for them to all go back to school, and that is their plan as well. I think that we've enjoyed this family time, and we're anxious to get back to a more normal schedule and have them get back to school.
Donald would like to know if you and the Med Center experts you consult with are in agreement about masks, whether they should be mandatory in public settings.
So Don Walton's asked a question about masks and the public health experts that we consult with. Certainly, again, I encourage people to wear masks, and the public health folks are also in agreement on that. With regard to mandates, that's a public policy issue. That's really in the realm of what the elected officials are held accountable for. So while we all agree on masks, the mandate is actually a public policy issue. So that falls into the realm of myself and the other elected officials.
Riley Johnson wants to know if the state will seek a court order to block Lincoln's mask mandate.
So Riley Johnson wants to know if the state will seek a court order to block Lincoln's mandate on masks. And currently, we're reviewing to see if the city has the legal authority to do it. And so I would say we're still reviewing it.
And he also wants to know, we had indicated in the statement on Friday that you had released that the mandate wasn't data-driven. What are you referring to when you say that?
So Riley also wants to know, he said this was not a data-driven decision. What am I referring to? It really is looking at the number of cases and the positivity rates, so forth, and things like that, the hospital cases here in Lincoln. While we have seen a few more cases, so for example, when I had the conversation with the mayor, I think the number of case counts in Lincoln was at 43, and the previous week had been at 31, so that was like a dozen or so new cases on a daily basis in a metropolitan area. That really wasn't that much, especially compared to where we've been in Omaha and other times in Lincoln as well. And then also, if you just look at the hospitalizations, which is really our guiding post here, is do you have the hospital capacity? I think at the time we were having the conversations, there were 26 people in hospital beds out of 378 total hospital beds here in Lincoln. So you're not even using up 10% of the capacity in Lincoln with folks. I think today, or as of yesterday rather, there were 29 people. I think 4 in the ICU, 3 on ventilators. So you can see very few coronavirus patients in the hospitals using up those hospital resources. And I mentioned at the top of the program, overall statewide, our ventilator situation is at 78%. So there really isn't a data-driven reason why you would need to continue to make more restrictions.
Sarah Kirkley says the Hastings mayor has asked DHHS to postpone YRTC's moves from Geneva to Hastings. What's your reaction to that, and is the timeline going to change at all in regards to his request?
So Sarah Kirkley is asking that, or has said that the mayor of Hastings has asked that DHHS delay the implementation of our YRTC plan to move the young ladies to Hastings. And are we planning on delaying that? Again, the role of the mayor, we gave him a briefing, a heads up, as a courtesy with regard to our plans. But the plans are really looking out for the best interests of the girls. And the sooner that we can get them to Hastings where we can have more resources, I think it's better it's going to be for those girls. So that's really what's driving our decisions. Like I said, we gave the mayor a courtesy briefing, but this is really about the best interest of the girls. And that's what DHHS is going to continue to focus on.
That's all for now.
And that's all we got there. Okay, great. So folks in the room. Martha.
About the Medicaid expansion plan, the ballot initiative said that the expansion population was to get the same level of Medicaid as other Medicaid recipients, but they're not being provided the same level. They're being provided a level minus some services that others get.
So Martha's question was about the level of services being provided to the Heritage Health adults. And Jeremy, I think I'm going to ask you to come up and talk a little bit about the benefit levels and how that compares with what was being provided before and what's being provided now. Thanks.
Thank you. Thanks, Martha. So I think the best way to look at this is that Medicaid has multiple programs with multiple benefit offerings depending on the situation of the individual and how they qualify. And so there is no one specific program that has the exact same coverage. So for example, children have more services than adults. Those that are disabled might have a different coverage or different eligibility coverage of benefits than others that aren't. So looking at people that are similarly situated, they would have a benefit package that's similar in nature to those individuals. Thank you.
How does it compare to the level of service provided to caretaker parents who are pretty analogous?
I think I could follow up with you on the specifics of that. That's not my area of expertise, but I'd be happy to follow up with you, Martha.
So and just follow up, that was on caretaker parents. You're going to follow up with Martha on.
Yep.
Great, thanks.
Absolutely.
Yeah, Andrew.
What do you think you gain by, I guess, getting things ready, taking this extra time to get things ready?
So the question was basically the time it takes to actually implement Medicaid expansion. It was to make sure that we could develop the technology systems. We had to go through the process with the Centers for Medicare and Medicaid Services to be able to go through this process and to get their approvals. And then, of course, to make sure we've got a great customer experience that when we roll this out August 1st, everybody sees that. So again, I think that when we get when people see the website, when they get the application process, that's what we're really looking at, is make sure we provide that great customer service. What has happened in other states that rush this process, they actually qualified a lot of people who actually didn't, or they allowed a lot of people into the program where those people didn't actually qualify. So for example, in California, there was hundreds of millions of dollars spent on people they know don't qualify. Well, that's a burden on the taxpayers, especially considering that the folks who you're giving those benefits to actually don't qualify for your program. So what we're doing is doing this in a way that's going to be done right. It's going to be a great customer experience, but also make sure that we're putting the people who are supposed to be on the program there and not people who don't belong in the program, so we can be respectful to the taxpayers. Go ahead.
And also, how did you solve the concern about not having enough doctors and medical services?
So the question was also about how did you solve the problem about not having enough doctors, which is another great point about, again, making sure we do this the right way. So if you think about it, under the old Medicaid system, or the original Medicaid system, I think about 75%, and Jeremy, you can get the exact numbers if you know them off the top of your head. I think about 75% of the services were for pediatricians. Well, with the new population being 19 to 64, we're not going to need a lot of pediatricians there unless you're one of those folks who's pregnant, right? So we had to go out and recruit new providers to be able to take care of the population that's coming in. And Jeremy, do you want to come and talk to us a little about that process about getting new providers to take care of the Heritage Health adult population?
Absolutely. Thank you. So one of the things that we began early on in the process is working with our managed care partners who credential providers to be part of their network and create contracts with them to add additional capacity. So throughout the fall of 2019 and into 2020, we received assessments from each one of our managed care plans to look at provider access and adequacy across not only PCPs and general primary care physicians and general practitioners, but also in specialty areas across the state. In Heritage Health, in our managed care plan, we already had access to those reports, but we also had them do stress tests looking at the potential capacity, the additional members that might be coming on based on the area of the state that those members might be joining Heritage Health Adult through, and ensure that they had additional doctors in their network and capacity to handle additional individuals as we see those new members join us through Heritage Health Adult expansion. Thank you.
Thank you, Jeremy. Yeah.
So was there ever a conversation with Mayor Larry and Giller Bear about having a mask mandate in Lincoln?
So again, the question was there ever a conversation about having a mask mandate with the mayor here in Lincoln? And again, as I've talked about, we try to make this a collaborative process. So yeah, we had conversation with the mayor and Pat Lopez, who's the interim director here for the Lincoln Lancaster Public Health Department. And we had a conversation about the pros and cons of doing a mask mandate. And obviously they've decided to go forward with it, but we certainly discussed it. Yeah, Andrew. No.
Did you know that she was gonna do this before she did it? Did she give you a warning, or was it just, did you learn when we learned?
So the mayor in our discussions had said that's what she was considering, the mask mandate. And I do believe her office called over shortly before they made their announcement to let us know that, yes, officially they were going to go forward.
What was your initial reaction to that?
Well, just the statement we put out that we disagree with the course they're going down. We certainly encourage masks. We think people should use masks in the appropriate situation. But this was not a data-driven decision, and so we disagreed with her decision to go down the mandate. Yeah, Martha.
Governor, you may have disagreed with the decision, but isn't this a matter of local control, and aren't you a fan of local control?
So Martha's question is, hey, isn't this a local control issue? Aren't you a fan of local control? Well, think about if we had 500 different rules for the over 500 municipalities we had here in the state of Nebraska. So, we do have to have some consistency so that people will know what they're doing when they're going from one location to another location. And this isn't the only issue we've had this, discussion about. So we got to strike that right balance here in the state, and we want to make sure that what we try to do is keep the state relatively together so that people would understand where we are with regard to restrictions and so forth, so that they wouldn't have to worry about if they were going from one city to another, that they're going to be somehow getting in trouble or maybe getting a ticket written for not doing the right thing.
We have a question from Justin.
So I just think, Martha had a follow-up, I think.
Just as far as keeping the
So Martha's asking, during the course of this, managing the pandemic, we have allowed different states to, or different parts of the state based on public health departments, which are generally multiple counties. So Lincoln Lancaster is kind of an exception. Douglas County is also, kind of the only two, well, Douglas County, Dakota, and Lincoln are the only three that are just one county. Everybody else is multiple counties. So when you're talking about, we did allow, based upon the conditions and the data, for example, we rolled out restrictions more tightly as people started having cases, and we've loosened up restrictions as people had fewer cases and kept them in place where we had maybe more cases, like, for example, in Hall County in the Central District. So we have made adjustments, but those have been at a public health district, and they've been data-driven decisions based upon what the conditions on the ground were like and what we thought would require. We work collaboratively with our public health departments to be able to, make those decisions. And, for example, Loop Basin moved on to phase 4 because the public health director felt they were ready to do that, and we agree with them, where the rest of the state is going to be remaining in phase 3 for the time being. So we do, you're right, we do make some changes, but again, go look at how many counties are in Loop Basin and what kind of land area. It's not one city. The difference between a public health department where we only have 19 versus over 500 municipalities is much easier to be able to keep track. Taylor.
We have a question from Justin at the Scottsbluff Star Herald. He's asking if you're concerned that people in the Panhandle are not using masks with regular frequency.
Justin at the Star Herald is asking if I'm concerned that people in the Panhandle are not wearing masks with regular frequency. And again, if you can maintain that 6-foot distance between you and other people, you don't necessarily have to have a mask. If you're going to be closer than 6 feet, that's a really good opportunity to be able to wear a mask, especially if you're going to be inside. So, Justin, it really depends on the circumstances, on when you wear a mask. What we do want people to do is really start using that as just part of what they do everyday life and make it a part of just kind of what they're, how they're responding back to the pandemic and using their judgment and common sense on when do they have to use a mask. It's a tool to be able to slow the spread of the virus. It's not the only tool, right? You can keep 6 feet away from other people. You wash your hands often. Those are other tools we have to be able to slow the spread of the virus. But I would certainly encourage the Star Herald to continue to educate people on when the appropriate use of a mask is. Andrew.
You talked about a lawsuit that blocked Lincoln from implementing the mask, mandatory mask, but will you withhold funding, I guess, CARES money? And if so, how will you do that? How much will you withhold? Is it all or nothing?
So Andrew's question was, hey, you're considering whether or not the mayor has the legal authority to be able to issue the mask mandate, but are you planning on withholding funds? And we don't have any funds. The mandate the mayor put in place does not impact, for example, our state office buildings, does not impact people seeking services at the county or city level, so we don't have any plans to have her decision impact how we distribute the CARES Act money.
So it would be just a question of whether or not you could block that, on a restraining order or something like that.
Well, again, we're still reviewing whether or not the mayor has the legal authority. Yeah.
So in the mayor's mandate, she says if a business can guarantee 6 foot of social distancing inside, that you don't have to wear a mask. So it kind of also encourages that too. If you are within 6 feet, you encourage people to wear masks. So why are you so against this mandate?
So the question was, hey, so why are you against mandates? Because again, I think that we ought to be doing what we've done throughout this entire pandemic, which is we've asked Nebraskans to do the right things. And then by and large, they have. So I might point out that we were one of 7 states that didn't issue a stay-at-home order or a shelter-in-place order, right? We did our campaign of 21 days to stay home, stay healthy, stay connected to be able to flatten the curve and preserve our hospital system. And guess what? Nebraskans did it. It worked. So we didn't bring the heavy hand of the government down and tell people what to do. We asked them to do the right thing, and Nebraskans, being community-minded people, they did it. And masks are the same thing. We have managed through the peak of our cases and the peak of our hospitalizations without having a mask mandate. Why do we need one now? We've been able to manage this by asking people to do the right thing. We should continue to educate. We should continue to communicate the importance of wearing a mask. But to bring the heavy hand of the government and tell people what to do, that to me just seems overbearing. Yeah, Andrew.
A couple of the big teachers associations came out, having concerns about, opening up schools this fall, going back, and some of their members, I guess, how do you respond? What would you tell those teachers?
So the question was with regard to the couple of teachers' unions in Omaha and Lincoln have said they don't want to be in classrooms this fall. And to me, it's about what's best for the kids and balancing that off again with the health needs of teachers who may have additional health issues. So look, there are kids, not all of them, but there are kids who will learn best in a classroom setting. Special needs kids, I've been told especially, need that personal interaction to be able to help learn. And so that's why the Commissioner of Education and I think it was probably about a month ago, said our expectation would be that kids would be in classrooms this fall. Now, if there are teachers who have underlying health care conditions and are older, certainly we want schools to make accommodations for those teachers. Same thing for the kids. If there are kids that have special health needs, we want schools to be making accommodations for them as well. But I think what we want to do is think about the best interest of the kids and what is it for them to be able to help learn and make sure not only are they learning, but all the other things that go along with being in the classroom, making sure they're getting the proper nutrition, making sure, one of the things we've seen, for example, is that our calls into our child abuse hotline have dropped. Why? Because teachers are a large percentage of the calls that go into those hotlines. So that's an aspect. We know that, kids need to be socialized. They need to have that social interaction. And so there's behavioral health issues that goes along with this. So there's a lot of other things besides just the learning that are important for kids to be in classrooms. And so that's why I think it's important that every school district and every superintendent and every school board work to be able to accomplish that goal is what's in the best interest for the kids. Other questions? Martha.
Congress is considering another relief package, and are you in favor of additional relief from the federal government?
So the question is, Congress is considering another stimulus package. Am I in favor of such a thing? I am not in favor of us continuing to run up literally trillions of dollars of debt that will burden our children, grandchildren, great-grandchildren. So, here in the state of Nebraska, we have been very good stewards of the taxpayer dollars on how we've managed our budget, not just during the current pandemic, but for the last several years. And that's one of the reasons why we are in relatively good shape. The fiscal year that just ended June 30th, we were actually even a little bit over on our revenues from where we forecasted they would be July of 2019. And so we were able to add $10.6 million into our cash reserve. And so what we have to do is what all families have to do is continue to manage, right, our budget to make sure we live within our meetings. And yeah, special circumstances happen, but we can manage through it. And so I think that Congress needs to be very cautious about whatever they're going to pass as another stimulus package, because we are running up trillions of dollars of debt, and that is just going to continue to burden generations to come.
Senator Stinner said that some of those federal stimulus dollars helped the state come out at the end of the year as well as we did, because it helped put money in people's pockets so that they could continue to spend and pay sales tax dollars and so forth. And you're suggesting that perhaps that, I'm not quite sure you're saying this Congress should not continue to do that?
So the question was, Senator Stinner said, hey, the stimulus package has helped the state of Nebraska, and that's absolutely true. Nebraska has taken advantage of the Paycheck Protection Program as one example. I think we're one of the top states to be able to cover the payroll at small businesses that help keep people employed. And there was no doubt that Congress had to act to do as far as the stimulus early on. However, now we're talking about multiple stimulus packages later. At some point, you got to stop. And what I'm saying is Nebraska is in a situation where we can continue to manage this without an additional stimulus. So that's why I'm saying Congress needs to be very cautious about running up this additional $1 trillion in debt. They've already responded to it. I think that the programs they've put in place, like the Paycheck Protection Program, have worked. And so we need to be thinking about how are we burdening those future generations. Other questions?
Anything more about getting Test Nebraska to help out the football program?
Anything more about Test Nebraska helping out the football program? Again, we are continuing to work with all of our institutions of higher education with regard to their plans to opening up this fall, with regard to PPE and testing and so forth. So we're going to continue to have that conversations to be able to help meet their needs. So that'll be a part of it. I don't have any specific thing to talk about with regard to the football program. The Big Ten still needs to decide how they want to be able to handle that. But we have had some conversations with regard to some of the other sports and making sure that if there is testing required, figuring out a plan to be able to help them be able to do that. And, you know, with Test Nebraska so far, again, I'd encourage people to sign up for testnebraska.com. We've got 232,000 people signed up. We've done over 91,000 tests. We are right now, for example, I mentioned we got 6 days of 1,200 slots a day in Omaha. We've got 6 days of 500 slots a day here in Lincoln. So we've got the slots and the demand. So please sign up for testnebraska.com. It's a great way to help control the virus here in our state.
Have you
Yeah.
yourself been tested?
I have been, yes, I have been tested, as a matter of fact. And when I went to the Test Nebraska site down at the CHI Health Center, it was a very slick process. I think they got me in and out there in about 5 minutes. Maybe it was 10 minutes, but it was very fast, very quick. All right, folks. Well, again, thank you very much. Appreciate you all joining us. Remember, 1 p.m. tomorrow, we'll be talking about back to school with regard to the pandemic. So 1 p.m. back here tomorrow, we'll be talking about that. And everybody have a great rest of your week. Thanks.